Good morning, good afternoon, and good evening. I'm Takahiro Namdi from Sasakawa Health Foundation. Welcome to the third day of our webinar, Zero Leprosy for Whom. Before we start, I just want to have two quick announcements. First, we have interpretations in French, Spanish, and Portuguese. So for those who need interpretation, please choose your favorite language from your interpretation box under your screen. Second, we have a Q&A session after the panel discussion. Please send your questions through Q&A box under your screen. It will be great if you can send your question in English so that our secretariat can understand. All right, so let's start for day 3. First, I want to invite Ms. Day3 from India to share her reflections about day 2. She is representing IDEA International. So, Day3, floor is yours.
Thank you so much, Professor Nandri, for this opportunity. Thank you to the Sasakawa Foundation, and thank you to IDEA, of which I'm the board member, for this opportunity. And so let me start with how day 2 went. We had a wonderful opening with my dear friend, Mr. Amar Timalsina, board member of IDEA, who presented the summary of day 1. And then we had several video messages by representatives of organizations of people affected by leprosy. I would like to mention in brief a few of the notes that I made, and which was impressive. Every presentation was impressive. We had, different areas, countries represented, and there were some common threads, and there were also specific issues. Ms. Lilibeth presented about her work with Purple Hope Initiative, and there was the impressive array of services rendered, focus being for women and children affected by leprosy. I was particularly impressed by the kind of work in terms of health awareness campaign, partnering with Junior Chamber International, which seems to be a great opportunity to carry out these campaigns. And there were programs for women on leadership, which I think is very critical. Being a woman myself who's been affected by leprosy, I understand how important leadership and autonomy is. Very importantly, there was, the work done on WASH, as we know, which is a short form for water, sanitization, and hygiene practices. Masks were distributed. Many families, over 100 families, got material for food, and young children, school-going children, got education items. So this was very wonderful promotion of what is possible in terms of community work. We also had very, very impressive work of Atma Swabhiman. And I must add, before I end the talk about the various work done by representatives, that the commonality was the support given by Sasakawa Foundation. So really grateful for the kind of work that Sasakawa Foundation doing with many agencies. Mr. Shailendra presented about Atma Swabhiman. The core value of this organization being enhancing of self-dignity, and it's very important to have a self-identity and respect. And they work on economic rehabilitation. During the COVID pandemic, they also had entrepreneurship in terms of masks making, and there were some sessions on educating people on social distancing, cleanliness, etc. We had a great presentation by Mr. Ramesh Kumar Chaudhary of the Nepal Leprosy Trust. And the mission of this trust is for self-help. And while there are 4 districts with several NGOs, the plan is to expand to all the districts. And as it is, they have 112 self-help groups. And I've met some members from this organization. I'm particularly impressed by the kind of work they do of standing on their own feet and also providing support to communities instead of only taking support, which is really commendable. And they have a very active working committee. And the committee of these groups, I find from the presentation, that they're very well regulated. The fact that they meet every week and they, plan out the activities. Um, uh, it was nice to see that any suspected leprosy cases are taken up, and then self-care is taught. Livelihood is a part of the activities, and training is taken up so that people can train themselves and get into some kind of livelihood projects. A lot of work is done for coordination with the government, and advocacy for rights of people are taken up. Likewise, there were presentations from Nepal, Ethiopia, where awareness, capacity building, stigma reduction, and the work of COVID was very impressive. More than 3,000 people have already been reached out, which I found was extraordinary. Then we had presentation from Mr. Tahir of Bangladesh, and there was a focus on the self-help group, which I found was very, very good. There was Mr. Mohammed, the Executive Secretary of Tanzania Leprosy Association. Again, focus was on awareness, raising, advocacy, health, education, and also
militância.
the work with Tanzania government to eliminate leprosy. And this is a lesson we can all take, that every charity working with for leprosy could take up advocacy with the governments. And there was also a lot of, all of the agencies spoke about mask distribution, supporting people in understanding about COVID. And so I can see the kind of support and response to COVID was really, very, very impressive. And then we had comments from experts, and particularly would like to speak about Mr. Jose's representation, being a board of director of IDEA. This IDEA itself stands for Integration, Dignity, and Economic Advancement. And the strength that it started with continues even today after several decades. And Mr. Jose particularly mentioned that one thing which has changed is that in 2020, the number of cases diagnosed were less than 250,000. But what has not changed is a negative attitude. The stigma continues, and that is something that we have to work on. With 15,000 members currently, I think IDEA is moving from strength to strength, and IDEA is always happy to partner with other agencies. We also had Kirsten Bense of Indonesia speak on similar lines. And then the interesting part which ended the session, the conference, was the panel discussion. And as we all know, Dr. Alice Cruz is a great advocate for the cause of leprosy, and she especially empowers women. And no wonder that this specific session was led by her. Issues with regards to women and children were taken up, and we had panelists, Ms. Lilibeth, Mr. Shailendra, Ms. Sarita, Mr. Burke, and Mr. Mohammed Shahid Sharif, and Ms. Farika Ali Mitu from Tanzania. So there were countries, Nigeria, India, Nepal, Ethiopia, Bangladesh, and Tanzania represented. The common thread in all the talks was about the fact that women are doubly impacted with being women, with then poverty, and then a disease like leprosy. So there was an appeal to support women at all levels. Special appeal was to create support for providing leadership, and also the fact that women anyways have a lot of responsibilities. So it's really doubly important to empower women. There are cases we always hear about where women are thrown out, and then divorces become natural because a woman has suffered from a disease that has this issue of stigma. Self-help groups have really helped. So many of the groups, many of the speakers spoke about the importance of self-help group, and also support for economic advancement, like loans to start business, creating support groups like advocacy groups. And one important thing that I was very impressed by was the appeal for government allowances for women with leprosy, and the fact that women anyway are supporting themselves and their communities in terms of helping with wash programs, sanitization, mask, making masks, etc. But still, there are these challenges. And one appeal was really good, which was to create opportunities for health insurance. And I was really impressed with this. And I thought, how come I didn't think of this? And I think we should promote the same thing in every country. And I'm really interested to take it up for our country. Human rights issue has been very important, and Dr. Alice has been advocate for rights-based approach when it comes to supporting the cause. And one of the barriers, some of the questions that were raised were very interesting. One was on the barriers to participate in self-help groups for people in remote areas. And also, we closed the discussion with a very pertinent question as to how do we deal with shortage of MDT. And very exciting news for, to answer that is that Moorhan has initiated a petition for production and distribution of MDT. And I think we all should become signatories of this petition and make this petition a grand success. So with this, I would like to close my comment about day 2. And thank you for your intent listening, and thank you for the opportunity.
Thank you very much, Day3, for sharing the summary of the yesterday's discussions very comprehensively. For your information, I just want to say about her incredible work. She is quite active to support the community of the persons affected during the COVID-19 pandemic. And I suppose, one of her work in Kenya will be introduced by friends from IDEA Kenya today. So thank you, Day3.
Thank you, pleasure.
Now we'll move on to the video presentations. We have 5 presentations today. So the first presentation will be made by ASCL MTN Senegal. So please show the video.
Grâce au soutien et à l'encadrement de la DAO Sénégal, elle a été créée le 14 juin 2014 une association à but non lucratif dénommée Association sénégalaise de lutte contre la lèpre et les maladies tropicales négligées. Une association qui dispose de reconnaissance juridique délivrée par le ministère de l'Intérieur et de la Sécurité publique. But et objectif, c'est d'unir les membres animés d'un même idéal, créer entre eux des liens d'entente et de solidarité, mais aussi promouvoir l'inclusion des personnes affectées par la lèpre. Nous jugeons aussi nécessaire de faciliter la réadaptation, éducation, moyens de subsistance, empowerment des personnes affectées par la lèpre, mais surtout également faciliter l'inclusion au sein de leur communauté de base. Comme nous le savons tous, les personnes affectées par la lèpre sont souvent stigmatisées, discriminées par leur communauté de base. Donc notre rôle est de tout faire pour faciliter leur inclusion au sein de leur communauté de base. Depuis le début de la pandémie en février 2020, au Sénégal, l'Association sénégalaise de lutte contre la lèpre et les maladies tropicales négligées a mené des actions de solidarité envers les couches vulnérables pour atténuer l'impact de la crise sanitaire. Nous avons procédé en outre à de l'appareillage, de la sensibilisation sur les mesures barrières et la distribution de kits alimentaires aux personnes les plus vulnérables. L'article 11 de la Convention internationale des droits des personnes handicapées établit que les États parties doivent prendre toutes les mesures nécessaires pour assurer la protection et la sûreté des personnes affectées par la lèpre dans le cadre de la réponse nationale aux situations de crise et situations d'urgence humanitaire. Cela comprend des mesures dans tous les domaines de la vie des personnes affectées par la lèpre, y compris la protection de leur accès au meilleur état de santé possible, sans stigmatisation et discrimination, le bien-être général et la prévention des invalidités, ainsi que des mesures visant à assurer la protection contre les attitudes négatives, l'isolement qui peuvent survenir pendant la crise. En mettant en œuvre leurs obligations en vertu de la Convention internationale des droits des personnes handicapées et en respectant les engagements pris dans le programme de développement durable, les États seront en mesure de protéger les droits et le bien-être des personnes affectées par la lèpre. Ce faisant, les États devraient tenir compte de la diversité en mettant particulièrement l'accent sur le sexe et l'âge et sur la situation des personnes affectées par la lèpre confrontées à des privations et à des difficultés. Les personnes affectées par la lèpre sont souvent laissées pour compte dans les campagnes de sensibilisation contre la COVID-19. C'est dans ce cadre que l'Association sénégalaise de lutte contre la lèpre et les maladies tropicales négligées a noué un partenariat avec la Fondation Sasakawa. Depuis le 18 novembre 2020, s'est établie une convention entre Sasakawa Health Foundation et Association sénégalaise de lutte contre la lèpre, en vue de renforcer le niveau de résilience chez les personnes affectées par la lèpre durant la pandémie du coronavirus. Le 28 novembre 2020, nous avons tenu une réunion de partage du projet avec les membres du comité directeur de l'Association sénégalaise de lutte contre la lèpre et les maladies tropicales négligées pour une meilleure compréhension du projet et définir un plan d'action pour la mise en œuvre du projet dans les zones d'intervention, à savoir Dakar, qui notifie beaucoup plus de cas, qui fait partie des zones les plus endémiques de la lèpre au Sénégal, Koutal et Sowan, qui sont des villages de reclassement où anciens malades de la lèpre et nouveaux cas de lèpre y vivent avec leurs familles. De plus, le respect des gestes barrières est parfois un vrai défi pour les personnes affectées par la lèpre. Par exemple, du fait des séquelles liées à la maladie de la lèpre, plus particulièrement les difficultés de se laver les mains. Les mesures prises pour éviter la propagation du virus ne permettent pas toujours aux personnes les plus vulnérables, marginalisées et à risque de se protéger efficacement. Les personnes affectées par la lèpre sont particulièrement à risque face à cette crise sanitaire. Pour atténuer ces risques, une formation sur la lèpre et la COVID-19 pour une bonne compréhension de la maladie en vue de sensibiliser les personnes affectées par la lèpre et leurs familles pour le respect des gestes barrières. Une autre formation sur le handicap et la lèpre s'est tenue pour comprendre et faire le lien qu'il y a entre ces deux thématiques. Pourquoi les personnes handicapées de lèpre sont classées chez les personnes handicapées, mais qui souvent sont laissées en rade dans les organisations de personnes handicapées de façon générale. La question de la leadership des personnes affectées par la lèpre doit être au cœur des discussions si on veut atteindre une bonne pleinement participation des personnes affectées par la lèpre au sein des organisations de personnes handicapées. La combinaison de facteurs tels que la lèpre, le handicap, le genre et l'âge génère souvent de multiples formes de restrictions à l'accès aux services sociaux de base. Certaines difficultés d'accès aux services rencontrées par les personnes affectées par la lèpre se sont ainsi intensifiées pendant la pandémie du COVID-19, associées à l'état d'urgence instauré par les autorités qui ne facilitent pas une pleine participation des personnes affectées par la lèpre. Pour juguler les difficultés dans le cadre du projet, nous avons entamé des distributions de kits, dont 40 kits scolaires distribués à Dakar et 40 kits alimentaires aussi distribués à Dakar. Il nous reste à faire Koutal pour 25 kits scolaires et 25 kits alimentaires et Sowan pour 25 kits scolaires et 25 kits alimentaires. Une journée de sensibilisation a été menée et de communication sur la COVID-19 pour le respect des mesures barrières, accompagnée d'une distribution de masques, d'affichage, des messages sur les gestes barrières et de gel hydroalcoolique. Le 31 janvier 2021 est célébrée la Journée internationale de lutte contre la lèpre. Une journée de plaidoyer et de sensibilisation à l'endroit des personnes affectées par la lèpre. En ce jour de plaidoyer, nous lançons un appel à l'endroit de la communauté que d'éviter la stigmatisation et la discrimination des personnes affectées par la lèpre. Ces personnes font partie intégrante de la communauté. Donnons-nous la main pour combattre cette maladie qui est toujours là et qui fait toujours du mal. L'Association sénégalaise de lutte contre la lèpre, par ma voix, lance un appel à toute la communauté qu'on se donne la main dans la main pour lutter contre la lèpre. Évitons de stigmatiser et de discriminer les personnes affectées par la lèpre. Ensemble, nous vaincrons la maladie. Regardons la lèpre en face.
So thank you very much for the presentation. It is the first time for our foundation to work with ASCL, MTN, and it is our great pleasure to be able to establish a new partnership through our project to respond to COVID-19. So next, I want to invite Idea Kenya. So please show the video.
My name is Joshua Thomas Oraga. I am the National Coordinator of Idea Kenya. I am a person affected by leprosy. We started the Idea program in the year 2007 with 4 people, but the organization has since then grown to have 800 members who are spread across the country, especially in the region that is still reporting leprosy. That is in Kwale at the coast, in Kilifi at the coast, in Nairobi, in Homa Bay, in Migori, and in Busia. Our main activity includes advocacy against stigma and discrimination of people affected. We also support community-based rehabilitation. We also support education for children of people affected. We also support economic empowerment of our individual members and also promote human rights and dignity of people affected by Hansen's disease. When the COVID pandemic broke out, our first activity was to see how our members could quickly develop resilience against the disease. So we started by doing mapping of resources, both local and international, and also to link our members to the COVID support programs that were going on around them. We managed to register 110 of our members into government COVID support program, which was mainly cash transfer, monthly cash transfer for the most vulnerable. But our main challenge at that time were the community of Tanzanians who live in Kenya as street beggars. So, but we were lucky that having done mapping of local resources, we were able to get support from different organizations, including Kenya Pipeline Company Foundation Department, including Hindu Council of Kenya, including Interconnected Health Solution, including Sai Satya Center, and also individuals. Day3 all the way from India and our friends were able to send us money, which we used to buy relief food and self-care packs for the people.
Asante sana Mwenyezi Mungu anaotupatia chakula kama hii. Nawashukuru sana kama watu wanaotusaidia kama hapa. Nashukuru sana tena, babarikiwe sana. Nashukuru Mwenyezi Mungu, babarikiwe.
We hope that the pandemic will end very quickly, so that programs, leprosy programs, and normal way of life can quickly resume. And that is why we strongly ask the international community, and especially the donor community, to strongly support programs that will help people recover, especially the livelihoods, because most of the livelihoods have been shattered. Most people are no longer doing what they used to do for their living, and I think that one will really help the community of people affected by Hansen's disease, both locally and also globally. Thank you.
Wow, I'd like to congratulate Idea Kenya to produce such a spectacular video. I'm quite familiar with their activities because they frequently disseminate information through SNS. Our foundation is so pleased to work with this organization. And for your information, Day3 is the one who connected Idea Kenya and the Indian communities in Kenya to respond to the COVID-19. I congratulate the work of Day3 here.
Thank you. Thank you so much.
So next, I want to invite Aremo, Mozambique. So please show the video.
Olá a todos, meu nome é Chamada Abibo, sou membro da ALEM e coordenador de projetos. Todos os projetos que estão sendo implementados na associação, eu que estou em frente e também estou a motivar os membros para implementar esses projetos para a sua sensibilidade. Obrigado. A Associação ALEMO localiza-se no norte de Moçambique, na província de Cabo Delgado. A Associação ALEMO foi fundada em janeiro de 2000 e a associação tem como missão de unir e organizar as pessoas atingidas pela lepra e a associação para a luta comum e inclusão na sociedade, na defesa dos seus direitos e combate de estigma, discriminação e pobreza. A atividade da associação durante a Covid-19, a ALEMO manteve comunicações com os grupos por telefone, aconselhando os membros sobre a observância das medidas de prevenção da Covid-19, divulgada no decreto presidencial sobre o estado de emergência que durou de março a novembro de 2020. Se alguém ver as manchas mais claras, sem comichão nem dor, deve recorrer à unidade sanitária mais próxima, pode ser lepra. O tratamento é gratuito e não cura no curandeiro. Eu tive lepra, já estou curado, porque fiz tratamento. Tratando cedo, cura sem complicações. Na altura, não havia medicamentos associados. É por isso tenho deformidades. A lepra é uma doença causada por um bicho chamado bacilo de Hansen. Ele ataca na pele e nos nervos. Principalmente ataca nos membros superiores, inferiores e na face. Quando ataca esses membros, pode vir perder, desabilitado, perder os dedos das mãos, dos pés e também os olhos não fechar, porque aí já está com esse bicho. A minha mensagem é: continuemos a vigiar os novos casos de lepra e o seu tratamento precoce para não existir novas complicações. Caminhemos unidos para acabarmos com a lepra e a discriminação dos afetados. Obrigado.
So thank you very much for your strong and persuasive message. By the way, the last time I visited Mozambique was almost 3 years ago, and I missed to visit the office of Aremo. Originally, I planned to visit Cabo Delgado province, where Aremo is based in, but we changed the direction to Nampula in the very last moment. So I really hope I have a chance to visit the office in the near future. So next, I want to invite ALO Bangladesh. So please show the video.
আমি আপনাদের সকলকে শুভেচ্ছা জানাচ্ছি এবং আপনাদের জন্য আমার শুভেচ্ছা রইল। 2014 সালে প্রতিষ্ঠিত হয় এবং 2020 সালে বাংলাদেশ সরকার কর্তৃক এটা নিবন্ধিত হয়। বর্তমানে 9 সদস্য বিশিষ্ট কার্যনির্বাহী পরিষদ রয়েছে। সদস্য সংখ্যা 17,986 এবং 1500 ফেডারেশন হেলথ গ্রুপ স্বনির্ভর আলোর মাধ্যমে প্রতিষ্ঠানের মূল কার্যক্রম হচ্ছে কুষ্ঠ আক্রান্ত ব্যক্তি, প্রতিবন্ধী এবং হতদরিদ্রদের নিয়ে গঠিত স্বনির্ভর দলের প্রতিনিধিদের নিয়ে এই ফেডারেশনের অ্যাসোসিয়েশন সক্ষমতা বৃদ্ধি করা হচ্ছে। বৃদ্ধির উদ্দেশ্যে বিভিন্ন পর্যায়ে সদস্যদের অধিকার এবং প্রতিষ্ঠার জন্য যোগাযোগ, অ্যাডভোকেসি এবং পার্টনারশিপ উন্নয়ন প্রকল্প প্রতিষ্ঠিত করার জন্য আমরা কাজ করে যাচ্ছি। এছাড়া ফেডারেশনগুলিকে সহায়তা করা যেন সদস্যদের আর্থসামাজিক কার্যক্রমে তারা উন্নয়ন এবং উন্নতি ঘটাতে পারে। আলো সোসাইটি প্রধান কার্যাবলী কুষ্ঠ আক্রান্ত ব্যক্তি, প্রতিবন্ধী ও হতদরিদ্রদের নিয়ে গঠিত স্বনির্ভর দলের প্রতিনিধিদের দ্বারা গঠিত। ফেডারেশন অ্যাসোসিয়েশন সক্ষমতা বৃদ্ধি, উন্নয়ন এবং বিভিন্ন পর্যায়ে সদস্যদের অধিকার প্রতিষ্ঠার জন্য আমরা একযোগে অ্যাডভোকেসি, পার্টনারশিপ উন্নয়ন প্রকল্প আনায়নের মাধ্যমে আমরা কাজ করে যাচ্ছি এবং অগ্রগতি হচ্ছে। বর্তমানে আলো সোসাইটি সাসাকাওয়া হেলথ ফাউন্ডেশনের অর্থায়নে বাংলাদেশের কুষ্ঠ রোগীদের কোভিড-19 সহায়তা প্রদান প্রকল্প বাস্তবায়ন আমরা করতে যাচ্ছি। আমরা শুরু করেছি। বাংলাদেশ প্রতিটি বিভাগে প্রতিনিধিত্বকারী 9টি জেলার প্রকল্প কার্যক্রম চলমান আছে। বাংলাদেশে কুষ্ঠ আক্রান্ত ব্যক্তি, প্রতিবন্ধী ব্যক্তিদের তথা হতদরিদ্র মানুষের মাঝে কোভিড-19 সচেতনতা বৃদ্ধির জন্য আমরা যথাযথভাবে কাজ করে যাচ্ছি। সাসাকাওয়া হেলথ ফাউন্ডেশনের বার্তা কর্মশালার মাধ্যমে কুষ্ঠ আক্রান্ত ব্যক্তি ও প্রতিবন্ধীদের, হতদরিদ্র এবং ফেডারেশনের নেতাদের মাঝে প্রচার কার্যক্রম আমরা চালাচ্ছি। করোনা মহামারী লকডাউনের সময় বাংলাদেশে কুষ্ঠ আক্রান্ত ব্যক্তিদের ডিজিটাল আলসার সেবা, যাকে আমরা কুষ্ঠ আক্রান্ত হয়ে যে পা এবং হাতে পায়ে যে ঘাগুলি হয়, সেই ঘাগুলির সেবা প্রদানের জন্য আমরা বিভিন্ন ক্ষেত্রে কাজ করে যাচ্ছি। আমাদের মোট 7টি বিভিন্ন জেলায় আছে এবং আমাদের চট্টগ্রামে 7টি সেবা কেন্দ্র আছে, সেখানে আমরা আলসার সেবা দিয়ে যাচ্ছি। যখন লকডাউন চলছিল তখন খুব কষ্টে আমাদের প্রতিবন্ধী এবং কুষ্ঠ আক্রান্ত ব্যক্তিরা খুব কষ্টের মধ্যে ছিল। আমরা তাদের পাশে দাঁড়িয়েছি। যারা খেতে পারছে না তাদেরকে 3000 টাকা করে একটা গ্রুপের মধ্যে আমরা দিয়েছি। সেখানে অল্প হলেও কিন্তু তারা অন্তত কিছুটা কাজ করতে পেরেছে। এরপরে আমরা লেপ্রোসি মিশন ইন্টারন্যাশনাল, আমরা ঢাকার কিছু ইয়ে থেকে নিয়ে ডাপাতে আমরা কিছু ত্রাণ সামগ্রী আমরা দিয়েছি। কিন্তু এর মধ্যে শুধু এটাতেই একটু কম ছিল। এগুলি কিন্তু আমরা এলাকা ভিত্তিক, এলাকার যারা দানশীল ব্যক্তি ছিল তাদের কাছ থেকেও আমরা সংগ্রহ করে আমাদের এই লোকদের পাশে দাঁড়িয়েছি এবং এই লোকদেরকে আমরা দিয়েছি। আমরা তাদেরকে যতটুকু সহায়তা করার প্রয়োজন তাদেরকে ওই ব্যাগে ভর্তি করে আমরা এক ব্যাগ চাল, ডাল, তারপরে আলু, তেল, এগুলি আমরা বিতরণ করেছি। আমাদের এই 9টি জেলায় যে সমস্ত কুষ্ঠ আক্রান্ত ব্যক্তি, প্রতিবন্ধী ব্যক্তিরা কেউ মাছ বিক্রি করত, কেউ পান, বিড়ি, সিগারেট বিক্রি করত। তো এখানে যারা এই লকডাউনের সময় যাদের ব্যবসা বাণিজ্য, সব এই ক্ষুদ্র ব্যবসাগুলি তাদের ডাউন হয়ে গেছে, বন্ধ হয়ে গেছে, তারা অতি কষ্টে দিন যাপন করতেছিল। আমরা দেখে সেগুলি তাদের পাশে দাঁড়িয়েছি, তাদেরকে সাবান, মাস্ক এগুলি দিয়েছি এবং সেখানে কিছু অর্থও আমরা দিয়েছি। তাদের আগের যেই ক্ষুদ্র ব্যবসাটা পানবিড়ির দোকান এবং মাছের দোকান, সবজির দোকান, এগুলি যেন তারা আবার চালু করতে পারে, সেই জন্য আমরা নীলফামারী, তারপরে রংপুর, ঠাকুরগাঁও, চট্টগ্রাম, সিলেট এবং মাটিরাঙ্গা এবং মোটামুটি 9টা জেলায় আমরা এগুলি বিতরণ করেছি এবং এখনো আমরা করছি। যেগুলি বাকি অংশ আছে এগুলিতে আমরা দিচ্ছি। ধন্যবাদ। আলো সোসাইটি করোনা মহামারী 2020 সালের মে জুন দি লেপ্রসি মিশন ইন্টারন্যাশনাল বাংলাদেশের জরুরি রিলিফ কার্যক্রমের প্রকল্প বাস্তবায়ন করছে এবং 10,000 স্বনির্ভর দলের সদস্য ও তাদের পরিবারগুলোকে জরুরি ত্রাণ সামগ্রী আমরা বিতরণের ব্যবস্থা করছি। আগামী 31শে জানুয়ারি 2021 সালে যে বিশ্ব কুষ্ঠ দিবস পালিত হবে, সেই কুষ্ঠ দিবস আমরা পালন করব যথাযথ মর্যাদায়। সেই কুষ্ঠ দিবসে আমার প্রধান দাবি হবে যেই কুষ্ঠ আক্রান্ত ব্যক্তিরা যেই বৈষম্য শিকার হচ্ছে এবং সরকারি হাসপাতালগুলিতে চিকিৎসা পায় না, সেখানে যেন তারা ভালোভাবে চিকিৎসা পায়, আগের মতো যেন তাদেরকে দূর করানো হয় এবং তাদের প্রতি যে বৈষম্য, সেই বৈষম্য যেন করা না হয় এবং তারাও যে মানুষ, সেই মানুষ হিসেবে তারা মানবিক সেবা, এই তারা স্বাস্থ্য সেবা, মানবিক স্বাস্থ্য সেবা যেন তারা পায়, এই দাবিটিই আমার এখানে থাকবে।
Very impressive presentation. You know, our foundation co-organized a national conference of the persons affected by leprosy or Hansen disease almost a year ago, December 2019, with other NGOs, including TLM and Lepra Bangladesh. I am sure that ALO will be one of the leading organizations to establish a nationwide network of the persons affected in Bangladesh. Also, I should not forget to mention about TLM Bangladesh, with special thank, who plays crucial roles to support this organization. So the last group for today is SKSS India. So please show the video.
नमस्कार, माझं नाव मिलिंद सुखदेव बारशिंगे. मी एक कुष्ठांतीय आहे. कुष्ठांतीय म्हणजे पर्सन अफेक्टेड बाय लेपर्सी. आणि आज मला खूप आनंद होत आहे की मी आमच्या संस्थेचं तुम्हाला परिचय करून देणार आहे. आमच्या संस्थेचं नाव आहे सक्षम कुष्ठांतीय स्वाभिमानी संस्था. ही संस्था भारतातील महाराष्ट्र राज्यामधील चंद्रपूर आणि गडचिरोली या 2 जिल्ह्यातील समुदायामध्ये असणाऱ्या कुष्ठांतीयांनी एकत्र येऊन तयार केलेली संस्था आहे. या संस्थेची सुरुवात 2017 मध्ये करण्यात आली आणि आमच्या संस्थेचे मुख्य उद्देश आहेत कुष्ठांतीयाचे सक्षमीकरण करणे, कुष्ठांतीयाच्या मानवाधिकारांचे रक्षण करणे, त्याचबरोबर राष्ट्रीय कार्यक्रमामध्ये सक्रिय सहभाग देणे. या वर्षामध्ये कोविड-19 टाळेबंदीच्या काळामध्ये कुष्ठांतीयाच्या जीवनामध्ये जो परिणाम झाला, ज्यात त्यांना समस्या आल्या, तर त्या समस्या सोडवण्यासाठी आम्ही काही ॲक्टिव्हिटी राबवत आहोत.
In the COVID-19 lockdown period, the priority was given to maintaining supply chain of essential medicines for persons affected by leprosy living in the community, especially those having lepra reactions and neuritis. Medicines like steroids, other materials, MCR footwear and self-care kits were reached to persons affected's home. This helped preventing disability among risk cases prone for nerve damage. This activity was conducted jointly with the teams and community volunteers of our partner organization, Alert India. Thanks to Sasakawa Health Foundation granting COVID-19 support project to our organization during this difficult period of COVID-19 pandemic. 20 life members of our organization who volunteered for project activities were selected, trained and capacitated to carry out project activities such as need assessment survey among persons affected by leprosy to assess the impact of COVID-19 pandemic and their needs. Also conducting self-care promotion drive through home-based self-care services. 490 persons affected by leprosy from 180 villages in 8 blocks of Chandrapur and Garchwal districts were surveyed.
आता ही पद्धत आपण कुणाला करतोय ज्यांच्या हाताला विकृती आहे अदृश्य विकृती आहे जे आहे ते पूर्ण आपल्या हातामध्ये फिरलं पाहिजे मोडलं पाहिजे तर या अशा पद्धतीने
संजय गांधी निराधारच्या योजनेची तो काम करतो.
65 out of 490 persons affected assessed for COVID-19 impact and their needs were selected for direct financial benefit under Sasakawa Health Foundation support for livelihood support and emergency aid. Dr. Henke, District Leprosy Officer of Garchwal District, was invited as the chief guest at the function organized to distribute financial support. 14 persons affected received financial support either to start up or scale up livelihood activity worth of Indian rupee 100,000. In addition, 50 persons affected by leprosy received monetary emergency aid worth of Indian rupees 75,000 under Sasakawa Health Foundation supported project.
वाईट टाकण्यासारखे करायचे त्याला पाहायला तर लोकांचा दृष्टिकोन वेगळा होता परंतु हळूहळू
कुष्ठाचे स्वामी संस्था नागपूर जिल्हा चंद्रपूर यांच्याकडे जो स्वयंरोजगारासाठी जो पैसा मिळत आहे आपण कशासाठी मागून राहिलो आपण कशासाठी घेत आहोत याची जाणीव आपण पहिल्यांदा जाणून घ्यायची असते.
Besides generating financial support through Sasakawa Health Foundation and other NGOs in India worth of $23,500 among 450 leprosy persons to overcome COVID-19 impact, our organization also focused on promoting self-care practices among people affected leprosy living with disability. 28 self-care promotion camps were conducted at health facilities in public health system, reaching over 400 persons affected by leprosy living with disability.
जेव्हा आता घर झाला माझा दूषित झाला लागलो तेव्हा लोकांना काय ते लोक असं लोक आणि आपल्या डोळ्याने बघण्यात पाहिजे ते लोकांना आपल्या
कुष्ठरोगामध्ये विकृती हा एक अपघात आहे. अपघात टाळता येतात तशी विकृती पण टाळता येते. आणि जर विकृती आलीच तर जसे अपघातातून बरे होऊ शकतोय तसेच विकृती पण बरी करता येते. तर विकृतीला आणि कुष्ठरोगाला घाबरायचं का आणि भीती कशाला? भीतीमुळे स्टिग्मा वाढतोय आणि स्टिग्मा आला मग त्यापासून भेदभाव निर्माण होतात. कुष्ठरोगांच्या मानवाधिकाराचे उल्लंघन होते, त्यांचे संपूर्ण आयुष्य उद्ध्वस्त होते आणि त्यामुळे कुष्ठरोगाचा प्रश्न आणखीच वाढतोय. आपल्याला जगाला कुष्ठरोग मुक्त करायचं असेल तर त्याआधी भेदभाव दूर करायला पाहिजे आणि स्टिग्मा दूर करायला पाहिजे. आपल्याला मनातील भीती काढून टाकायला पाहिजे. आता आमचे एकच ध्येय, कुष्ठभयमुक्त समाज, कुष्ठभयमुक्त जग. चला आपण सर्व मिळून समाजाला आणि जगाला कुष्ठरोगाच्या भीतीपासून दूर करूया.
तो एक कुष्ठांतेय.
Wow, I should congratulate another spectacular video presentation. It is our first time to work with SKSS India, but we are keen to learn from them about the situation of the persons affected by leprosy living in ordinary community. It is our great pleasure to work with this organization. So, all right, now we can invite two experts to share comments about the video presentations. First, I'd like to invite Mr. Vilgaro, Secretary Director of the Global Partnership for Zero Leprosy. Bill, the floor is yours.
Thank you. Thank you very much. The Global Partnership for Zero Leprosy wants to thank you all and congratulate you on sharing your story with us. You've each highlighted very important community level work that persons affected are leading around the world with a focus on human rights, economic empowerment, and stigma reduction. I was also impressed with the work that you've done with support from the Sasakawa Foundation to adapt your assistance to persons affected during this unique time of the COVID pandemic to ensure that persons affected are receiving necessary food, medicine, guidance on self-care, and cash payments. We commend all of you on your programming successes. In Senegal, with ASCL MTN, I was particularly impressed with the fact that your organization has combined work with persons affected by leprosy, as well as other neglected tropical diseases. I think it's really important for those of us in the leprosy community to work with organizations that address other NTDs, and that you do excellent work in alignment with the International Convention of the Rights for Persons with Disabilities. And Mr. Araga from IDEA Kenya, I noted that the fact that your organization started with just 4 people in 2007 and now has over 800 members. And during the pandemic, you all performed really critical resource mapping activities to be sure you connected those in need with proper assistance. And this sounds like this even included those in need that were from other countries like neighboring Tanzania. And Alemo, your work during the pandemic sounded like it made a big difference to persons affected by ensuring that you stayed in contact by telephone to make sure that they received guidance for protecting themselves from COVID, but also other issues specific to monitoring skin lesions. And ALO, your coordination of self-help groups and implementation of what sounded to me like a very unique program for digital ulcer care to make sure that people affected were continuing to get proper care during the pandemic. And then finally, SKSS, conducting numerous self-care camps and workshops. I appreciated the videos that showed the work that you were doing in that area. And then also the important work that you were doing to make sure that critical supply chains weren't interrupted for important medicines that persons affected needed during the pandemic. We admire the commitment from all of you to build community, educate the public, and work tirelessly to combat discrimination. And thank you for your leadership during this very, very unique time during the COVID-19 emergency response in your countries, ensuring that each individual affected by leprosy continues to receive the support they need. Our global partnership for Zero Leprosy is a coalition of individuals and organizations committed to ending leprosy. We look to you and other persons who have experienced leprosy as experts. Persons affected serve as advisors on our leadership team and in our working groups. We encourage all of you to become members and to join us in our mission to reach Zero Leprosy. Thank you again for the important work that you do.
So thank you very much, Bill, for your very useful comments. And I especially appreciate, your presence as the Secretary Director of the Global Partnership for Zero Leprosy, because the Global Partnership should be one of the most important partners for the organization of the persons affected by leprosy or Hansen disease. I also thanks Bill for you to join this webinar. I know it's very early in the morning for you today. So next, I want to invite Mr. Arthur Custodio, National Coordinator of Moham, Brazil. So Arthur, floor is yours.
Bom dia, boa tarde, boa a todos que estão presentes. Antes de mais nada, eu queria cumprimentar a Sasakawa Nippon Foundation em função do importante trabalho que tem feito todos esses anos, né? O Mohan está com 40 anos e eu estou há 37 anos acompanhando a questão da hanseníase. E hoje no Brasil a gente está sofrendo um grave problema de falta de medicamento que começou no comecinho do ano passado e ainda persiste até hoje. E aí lembrar que a Fundação Sasakawa durante muitos anos doou medicamento para o Brasil e isso nunca faltou naquela época, né? Bom, enfim, comentar os vídeos dos nossos irmãos do Senegal, do Quênia, Moçambique, Bangladesh, Índia, na verdade me emocionar, né? Eu preferia assistir os vídeos.
I fall into tears. I had to watch the videos beforehand, otherwise I would cry too much. We have the power to reproduce the voice of persons affected by Hansen's disease. So each entity has its own characteristic because it is born, formed by the history of their leaders, by the history of what those leaders have experienced, and the political and cultural framework of each country. So it is impressive and exciting to see that during this pandemic, all of us, all the entities, were able to reinvent themselves, to grow, to face the issue of the pandemic and strengthen our entities. I think this has to do with our history. This has to do because we know what isolation is all about. We know what stigma is all about. We know what it takes to have a medication to cure people. We know how hard it is to have vaccination. We know how fearful it is to have sequels and spread the disease to other people. So that's what the world society has faced. In addition, we know what it is like to depend on authorities in terms of sanitation and politics, and we don't get a response from them. Maybe that's the saddest and most dangerous phase of the pandemics, and the saddest side of Hansen's disease. The other side of the pandemics made us realize how left aside we are. We got singled out. All over the world, there's pandemics in society. When society wants to do it, they mobilize themselves and solutions just come up, just appear. So all those years that we've been following the fight against Hansen's disease, there are no solutions. Why we have no new medication? Why are we short of medication in Brazil today if it isn't due to stigma, a stigma that is in the structure of society? Our entities do that. They fight against stigma on a daily basis. And I strongly believe that part of the lack of medication of Hansen's disease in Brazil is the structural stigma, because People should have solved this by now. It's been a year that we've had supply issues for the medications. The entities should have mobilized themselves already. It's because if it was a family member, we would have helped even more. So I'd like to say that there is a stigma, a strong stigma in society. So I don't believe that we are going to face stigma only as people. I think all those that are part of these institutions and those that have no institutions whatsoever, they have a very important role in society. But the issue that we face is that I believe in the organization, in the movements, as a form, a way to face and broaden people's voice, the voice of those affected by Hansen's disease. That's why I'm very thankful to all of you. Thanks for showing that every single national entity is not alone. We are with you in Bangladesh, Senegal, India, Mozambique, Angola, everywhere, all over the world. We need to strengthen national institutions so they can give voice to people. And to wrap up, I'd like to remember a quote. I'd like to quote Mahatma Gandhi. You never know the results your actions are going to give. But if you don't do anything, there aren't going to be any results whatsoever, any outcomes whatsoever. This illustrates the role of entities. I am thankful to all of you for encouraging us, for renewing us in the everyday fight. And Joshua Jayshri reminded us that we released a petition yesterday, and in 24 hours we have over 1,000 signatures. We need your help. We need to give voice, to raise our voices. That's the path. So my comments are of emotion and congratulations for you guys for your existence. Please keep fighting. Let's strengthen ourselves in the national paths and strengthen our fight against Hansen's disease and showing that Hansen's disease is a result of social inequality. And maybe one of the paths for us to face this structural stigma and this criminalization, because it's always everything is like the Hansen's disease is guilt. We sometimes have prejudice against ourselves. We are prejudiced against ourselves because stigma is in society. So we have to face maybe one of the best strategies for us to break this poverty cycle is to face inequality through education, educating more and more our members, family members, the families affected by Hansen's disease. Investing in education can be a perfect way ahead for us to face structural stigma. Thank you. And Sasakawa Health Foundation and Nippon Foundation to get us closer together in this moment. I know we've been doing this for many, many years, getting entities closer together, exchanging experiences and our knowledge. No one knows more than others. We can share. Thank you.
Thank you very much for your comments, Arturo. I really admire your tireless passion and endless inspiration to work for the persons affected by Hansen disease. I also want to congratulate that you yourself overcome your own disease recently. I think it is a great news for the whole leprosy community. So now I want to move on to the panel discussions. As a moderator, I want to invite Dr. Alice Cruz, United Nations Special Rapporteur on the elimination of discrimination against persons affected by leprosy and their family members. So the floor is yours, Alice.
Thank you very much, Taka. Good morning, good afternoon, and good evening to everybody. Again, it is a great privilege, honor, and pleasure to be here with you all today and to have the privilege of moderating this important panel. Well, after 2 fabulous days with lots of information to think about and to digest, today we will be discussing advocacy, awareness raising, and elimination of stigma. And it is really exciting to see how this webinar is bringing together historical organizations of persons affected by leprosy or Hansen's disease and new ones, combining accumulated knowledge with innovation. Advocacy, awareness raising, and elimination of stigma are key aspects of the work of the majority of the organizations of persons affected by Hansen's disease, and are indeed strategic to enforce the human rights of persons affected. Advocacy, awareness raising, and elimination of stigma are closely connected to participation. Almost all international human rights instruments include provisions on participation. Advocacy is also a key component of accountability, which is widely acknowledged as being essential for rights enforcement. To put it bluntly, governments only seem to act if they receive enough pressure from their citizens. The international human rights instrument that better develops issues of participation is, in my view, the Convention on the Rights of People with Disabilities, since it obliges states not only to guarantee participation's rights, but also to create the necessary conditions for people to participate in all matters that concern their lives, by eliminating all barriers to participation, from the lack of physical accessibility to the lack of access to education, among many other barriers. The CRPD also includes awareness raising as a key obligation of states to eliminate stigmatization and discrimination. Importantly, the CRPD framework recognizes harmful stereotypes such as prejudice against leprosy, false ideas about leprosy as a human rights violation. The principles and guidelines for the elimination of discrimination against persons affected by leprosy and their family members also speak about participation and awareness raising in several of its principles and guidelines. I'm saying all this just to re-emphasize how persons affected by Hansen's disease are protected by international human rights instruments. So today it is a great privilege to introduce the following organizations of persons who have experienced Hansen's disease, who will share their knowledge, expertise, practice, and vision regarding these issues. And today we have the Senegalese Association for Leprosy and Disease Control of Neglected Tropical Diseases, IDEA Kenya, ALEMO, ALO, and ASKSS. So again, I kindly ask the speakers to try to share their contributions on around 6 minutes so we can have enough time in the end for interaction with the audience. I will read now the guiding questions. They are bigger than the ones of the past days, but I think it is important to stress some of these points. So one guiding question is, for advocacy purposes, partnerships with government and other organizations such as NGOs and participation is very important. Can you please share your experience on advocacy, focusing on topics such as with whom? With the government, without government, against the government, for whom, how, which strategies, and with what goal? Second question, awareness raising can be promoted through different strategies within different partnerships, making use of different channels like the media, radio, community assemblies, etc. And at different scales, national, local, community. Please share your experiences and thoughts on what works best and what needs to be done more in this regard. So without any further delay, I kindly ask Mr. Papa Mamadou from the Senegalese Association for Leprosy and Disease Control from Senegal to share your expertise and vision with us. Papa Mamadou, the floor is yours, please.
Merci beaucoup, Dr. Alice Cruz.
Thank you very much, Dr. Alice Cruz. I say hello to everyone. I want to thank, first of all, and congratulate everyone who has shared. It was very interesting, and it really permits us to do a sharing of experience between organizations that are affected by leprosy. And I want to thank the Sasakawa Foundation. And it's very important for us as the organizations and people affected by this, like Alice Cruz said, in Senegal, if I refer to Senegal, our role is to help the people affected by leprosy, to pass by stigmatization and get rid of it, and do everything in what is possible to participate and to be effective. We cannot help somebody without being involved in asking them what they want and integrate them, to put mechanisms in place to help the structure. Suppose you want to help a situation, it will be easier to help. And when we fight in advocacy for Senegal, we propose on the international laws that Senegal ratified conventions and signed conventions. And these conventions are the documents for advocacy. These documents must be taken into consideration to really what the states sign in the United Nations and respect these signatures in their countries. And every time we fight for people that are touched by leprosy, these documents will be used to pressure the states for them to come and help people that are affected by leprosy. And obviously, as I've said before, in Senegal, we don't have all these problems because our organizations and the members of the National Committee Fighting Against Leprosy in Senegal has put in place a national committee against leprosy that is composed, has a program, a national program against leprosy, and partner in finances in Senegal and those organizations of people affected by leprosy. So we represent the people that are affected, and every time they take into consideration our recommendations, take into considerations so that people go forward. And as I've said before, nationally, and economic and social leprosy is being fought and put into work. And also, there is another program that is called the National Program of Adaptation. Everybody knows RBC, that permits us to really go to the lowest level and to meet the people, to try to find solutions to their problems. Because oftentimes we say that the time cannot fix everything. We have to see in the community, what can we do and what we cannot do, and to see the partners in Senegal to try to fix these different problems. And right now, the challenges also, let's not forget that leprosy is always present. And here in Senegal, if I refer to Senegal, our difficulties are the new cases that are in children. We have, that is what worries us the most. Leprosy
existed only in adults, and now we're seeing more and more that the transfer between 8 to 10 years old, 14 years old, 15 years old, there's more cases that have been detected in Senegal, and we're trying to see how to put in place a strategy to really see what is the problem that is happening with children. The association also has activities to protect and fight, and we say that we cannot forget the peoples. We have to pass the message quickly and effectively for everyone to have the information. And often I say there's a deficit of communication. If I talk about Senegal, we don't even talk about it. If we still have leprosy, it is because the organizations of people affected by leprosy, we don't hear about the cases. We don't hear the partners, the organizations. We have to hear about it, hear about leprosy in Senegal. Oftentimes, we have conventions with press organizations and TV, and every time that we need to communicate, we go see them. And communicate to make the people know the situations about leprosy. And that is what I wanted to intervene with. So if there are questions, we'll be here to answer. Thank you.
Thank you very, very much, Papa Mamadou. It's great to see you here. Well, without further delay, I will also now kindly ask Ms. Phyllis from IDEA Kenya, with the support of dear Joshua in translation, to please share with us your experience, your expertise and vision regarding issues of advocacy, awareness raising, and elimination of stigma. Ms. Phyllis, please, the floor is yours. I'm not
hello,
sure.
Alice,
Hey, Joshua, please go ahead.
Yeah, unfortunately, Phyllis has not shown up. I know where she lives and works. There is a very great challenge for internet connection, and probably that might have affected our participation in this important webinar. I might share briefly, if not in a very detailed way, for IDEA Kenya's experience, and because I'm also one of the national leaders of the program, and so I think I'll be able to put in something on our behalf and on behalf of our organization. Yes. So
absolutely. Well, internet problems we all face. It's a pity not to have Miss Phyllis, but please do go ahead, Joshua, and share with us the contribution from IDEA Kenya. Thank you very much, Joshua.
Okay, thank you. I will address this in two ways generally. One, I want to bring to everyone's attention the peculiar situation of the National Leprosy Program in Kenya. Since the year 1988 or thereabout, the country was declared leprosy free. I think using the parameters of less than one in 10,000 people. Using that parameter, our country was declared leprosy free. Kenya, again, is one of the few countries that are endemic, yes, but who have not been giving data to WHO on annual leprosy infections. And again, Kenya again is also one of the few countries that has no ILEP coordinating member for the leprosy program. That is after AIFO Italy left in the year 2014 or around there, or thereabout. This has put us in a very
peculiar situation. And I want to say that IDEA Kenya is probably the only organization that is interested in leprosy work. And recently during the international NTD conference that was held here in Nairobi, and that I personally attended courtesy of the Secretariat of Global Partnership for Zero Leprosy, the government admitted that leprosy is creeping back. It is creeping back because now they are getting leprosy in the young population as well as in the old population. Unfortunately, we don't have active case finding activities. And so that means that most of our cases are cases which represent at very, very late stages. Recently, and that was, I think, after our participation in International Leprosy Congress in Manila, we came back and we urged our government to subscribe to the Global Partnership for Zero Leprosy. And it was a very difficult work doing this, because at the national level, the leprosy program is put together with the TB. And every year, the government gives very little money to the leprosy program and a lot of money to the TB program. So you find that most of the staff in that department are only concentrating on TB because probably that is where the allowances are, that's where the workshops are, that's where the traveling is. And if somebody is posted to the leprosy program within that department, then they normally see it as a punishment. Nobody wants to do leprosy. So it's been very difficult to get the attention of the government to our plight. We are currently talking to the Ministry of Health, to the Ministry of Health, so that the leprosy program can be put together with the NTD program. Because the current director that we have for the NTD program is a person who really wants to do something on leprosy also, but his hands are tied because the leprosy program is lumped together with the TB program. So that's also a very, very big problem. Last year when we did the World Hansen's Disease Day activities through the grant that we were given by Sasakawa Health Foundation, we did up to 3 meetings with the National Leprosy Program. And despite the fact thinking that every time we would be doing these meetings, then we would be paying them allowances for sitting in these meetings, where we were only to remind them of what they are supposed to do. So it's a big challenge, and I personally, we are in our meeting, one of our recent meetings, we did say that we shall write to ILEP so that we find who can come to Kenya and replace what AIFO used to do here. Because it's very, very, I know that we have tried our best to get resources locally, but I think we will really go a longer way if we were to to actually which has really now built our capacity of donors. Alice, regarding the second issue of strategies for awareness creation, I want to say that right now I think we stand at a better position than we were 10 years ago, because Kenya has recently migrated all the media platform from analog to digital, and so there's been a lot of growth in vernacular radios, community radios, and this can be very useful tools to reach the people, because most of our members are not people that you would speak to in English or in Swahili. Most of them are people that you'd comfortably reach only in their own mother tongues. So the growth of FM radios, especially community radios, is to our advantage. Again, social media networks like Facebook is also very, very important. Kenya is one of the countries in Africa with the very high penetration of internet services. Actually, about 85% of the country is well covered by internet. So we are also leveraging on that on social media networks to create awareness about what we do, but also about leprosy generally. So thank you very, very much. I'm sorry Phyllis was not here to do this, but I think I've put in something for my organization.
Thank you very much, Joshua, and please send our greetings to Phyllis. Thank you very much for a great contribution. Thank you, Joshua. So now I would like to kindly invite Mr. Chamada Abibu from Alemo, from Mozambique. Alemo is the Association of People Affected by Leprosy in Mozambique. Mr. Chamada, por favor, the floor is yours.
Boa tarde.
Good afternoon. One more time. My name is Shamada Abibo. I am with the Alemo Association. Alemo is the Association of Persons Affected by Leprosy, by Hansen's disease in Mozambique, located in the province of Captain in Mozambique. The association was established in 2000, and we integrated 3 member categories. We have participating members, the ones that are not affected by Hansen's disease, but are part and help those people. Members, honorary members, the ones that donate, and effective members, the ones that are affected by Hansen's disease. The topic that we picked today is through advocacy. Within advocacy, we got a hold of persons affected by Hansen's disease in communities, and we have been mobilizing those people so they can get the message across regarding the signs of Hansen's disease, the diagnostics, treatment, and complications of Hansen's disease in communities, and also regarding the health of persons affected by Hansen's disease, so they can help each other and eliminate stigma, discrimination, and poverty. We have also mobilized the practice of self-care for enhancement of health of persons affected by Hansen's disease. We raised awareness regarding the practice of income generation practices for sustainability of those people. And also, we raised awareness of those people for against self-stigma. We showed them they have value, and it can make a difference in their communities. We also had community forums in the communities to work together with the population, local leaders, and persons affected by Hansen's disease. We covered several topics linked to people's lives, including stigma, discrimination, trying to find local solutions together to improve their lives. Also, during this moment of celebration of the World Day Against Hansen's Disease, my message is on fighting Hansen's disease and stigma. We will also have advocacy through communication forums, in the local radio systems, telecommunications, TV networks. We will also have advocacy with the government, which is made through contact with institutions of social support, like the ones we have here, and we will support people with disabilities. We're going to raise awareness in the government for social integration of persons affected by Hansen's disease, so that these people have access to jobs, medical service, hospital care, and that they support good integration of persons affected either in their relevant communities and fighting the disease. So this is the awareness we have been doing. When it comes to advocacy with the government or without the government, so with the government, we go to the offices, we talk to them, and we say, well, we are concerned. We want people affected to be integrated socially, spiritually, in all aspects of their lives. Also, speaking of the best strategy for advocacy, we've been using the radio, written messages, leaflets. So that's how we've been doing advocacy in this regard. Thank you.
Muito obrigada, Sr. Chamada. Thank you very much, Mr. Chamada. It was really a great privilege to listen to you directly today. I would like now to kindly invite Mr. Matyar Rahman from ALO, which means Advancing Leprosy and Disadvantaged People's Opportunities Society from Bangladesh, with the support of Mr. Alex Rowlin in translation. Please, Mr. Rahman, the floor is yours.
Thank you.
Thank you.
আলো কুষ্ঠরোগ আক্রান্ত ব্যক্তিদের অধিকার সুরক্ষা এবং বাংলাদেশ কুষ্ঠরোগ নিয়ে কুসংস্কার কমাতে জাতীয় আন্তর্জাতিক পর্যায়ে এবং স্থানীয় অংশীদারিত্বের সাথে কার্যক্রম অব্যাহত রাখছে। আলো কুষ্ঠরোগে আক্রান্ত ব্যক্তিদের কথা নীতি নির্ধারকগণ সংশ্লিষ্ট জাতীয় কর্তৃপক্ষের সঙ্গে সমঝোতার মাধ্যমে তাদের কাছে তুলে ধরছে। আলো 2 জন কার্যনির্বাহী কমিটি সদস্যদেরকে জাতীয় কুষ্ঠ প্রোগ্রাম, কুষ্ঠ ও যক্ষ্মা সমন্বয় কমিটি অধীনে সাব কমিটিতে অন্তর্ভুক্ত করা হয়েছে এবং 4 জন বিভিন্ন এনজিও কমিটিতে অন্তর্ভুক্ত করা হয়েছে।
ALO has been continuing its advocacy in national, international level and with local partners for securing the rights of persons affected by leprosy and reducing stigma in Bangladesh. ALO has made the voices of persons affected by leprosy heard by policymakers, concerned national authorities through advocacy in Bangladesh. Through executive committee, members of ALO are included in subcommittee under the National Leprosy Program, and 4 are included in different NGO committees.
আলো কার্যনির্বাহী কমিটির সদস্যরা জাতীয় ও আন্তর্জাতিক সম্মেলনে অংশ নিয়ে লেপ্রোসি বিষয়ে নিজেদের কথা বলছে। টিপি টকশো অংশ নিয়েছে এবং নিজেদের অধিকার এবং অধিকারের জন্য গণমাধ্যমের সাক্ষাৎকার দিচ্ছে। আলো সদস্য ও ফেডারেশনের নেতারা সরকারি সেবা প্রতির জন্য স্থানীয় সরকারি কর্তৃপক্ষের সাথে যোগাযোগ ব্যবস্থাপনার জন্য নিরলস চেষ্টা করে যাচ্ছে এবং ফলে কয়েকজন সদস্য সরকারি পরিষেবাগুলি পেতে সক্ষম হয়েছে।
ALO Executive Committee members participate at national and international conferences for voicing out to mainstream leprosy. The members participated in TV talk shows and given interviews in media for voicing out their rights and entitlements. Leaders of ALO and members of the Federation are continuously trying to build linkage with local government authorities for accessing government services. As a result, couple of members have been able to access the services.
ALO চেয়ারম্যান CRPD এর অধীনে কুষ্ঠ রোগ প্রতিবন্ধী ব্যক্তিদের অধিকার এবং CRPD-তে অন্তর্ভুক্ত করা জন্য জেনেভাতে 18 এপ্রিল 2019 এর আন্তর্জাতিক প্রতিবন্ধী ব্যক্তিদের অধিকার সম্পর্কিত একাদশ জাতীয় সংঘে কনভেনশন UNCRPD এর একটি অধিবেশনকে অংশ নিয়েছে এবং একটি প্রস্তাব উপস্থাপন করেছে। আলো সোসাইটি 2020 সালে ফেব্রুয়ারিতে আলো প্রতিবন্ধী নাগরিক সংগঠন পরিষদ PNSP এবং লেপ্রসি মিশন বাংলাদেশ এর সাথে যৌথভাবে প্রতিবন্ধীদের অধিকার সংযুক্ত জাতিসংঘে প্রাথমিক কনভেনশন সম্পর্কিত মতামত ও সুপারিশ জমা দেওয়া 23তম অধিবেশনে বিবেচনার জন্য। আলো 2020 সালে ডিসেম্বর মাসে বাংলাদেশ কুষ্ঠ আক্রান্ত ব্যক্তি এবং তাদের পরিবারের সদস্যদের জীবনে কোভিড-19 এর প্রভাব এবং কুষ্ঠ আক্রান্ত ব্যক্তিদের প্রতি বৈষম্য দূরীকরণের বিষয়ে সম্পর্কে একটি বিশেষ প্রতিবেদন জমা দেয় জাতিসংঘে বিশেষ দূত এলিসা ক্রুজের মাধ্যমে।
Chairman of ALO participated and presented a paper at the 11th United Nations Convention on Rights of Persons of Disability UNCRPD pre-session held on 18 April 2019 in Geneva to include people with leprosy disability under UNCRPD. In February 2020, ALO jointly with PNSP and the Leprosy Mission Bangladesh submitted voice and recommendations on the list of in relation to the UNCRPD report of Bangladesh for considering it on the 23rd session of the CRPD committee. ALO submitted a write-up in December 2020 on the discriminate impact of 2019 on persons affected by leprosy and their family members in Bangladesh to share with Dr. Elisa Cruz, UN Special Reporter on the elimination of discrimination against persons affected by leprosy and their family members.
জাতীয় ও আন্তর্জাতিক পর্যায়ে সংস্থাগুলির সাথে অংশীদারিত্বের মাধ্যমে আলো সোসাইটি বাংলাদেশ কুষ্ঠরোগ সচেতনতা বাড়াতে কাজ করছে। এছাড়া আলো সোসাইটি জাতীয় মিডিয়া নানান ধরনের সোশ্যাল মিডিয়া প্ল্যাটফর্ম ব্যবহার করে কুষ্ঠরোগ সম্পর্কিত তথ্যে প্রচার করছে এবং কুষ্ঠরোগ আক্রান্ত ব্যক্তিদের পক্ষে জাতিসংঘকে চিঠি দিয়েছে। সাসাকাওয়া হেলথ ফেডারেশন আর্থিক সহযোগিতায় 9টি জেলায় কাজ করে। সময় আলো সোসাইটি কুষ্ঠরোগ আক্রান্ত ব্যক্তিদের মঙ্গলের জন্য তথ্য কুষ্ঠরোগের ব্যাপারে ব্যাপক গণপ্রচারণা সৃষ্টি ভবিষ্যতে নেওয়া যা এমন কয়েকটি পদক্ষেপ চিহ্নিত করছে। কুষ্ঠরোগ সম্পর্কিত তথ্য বিভিন্ন গণমাধ্যমের মধ্যে দিয়ে প্রচার কার্যক্রম আরো বেগবান করা এবং কুষ্ঠরোগ আক্রান্ত ব্যক্তিদের অংশগ্রহণের আরো বেশি সমাবেশ এবং এসোসিয়েশন আয়োজন করা। কুষ্ঠ মহামারীর সময় কুষ্ঠরোগীদের জন্য আলসার কেয়ার সেবা চলমান রাখা এবং আরো গতিশীল করা। কুষ্ঠ রোগীদের জন্য কোভিড-19 ভ্যাকসিন ব্যবস্থা করা, দেশের মেডিকেল কলেজ সহ সকল সরকারি হাসপাতালে কুষ্ঠ রোগী গজনের জটিলতার সেবা ব্যবস্থা করা, সামাজিক কুসংস্কার তথ্য শ্রেণীগামা কমিয়ে কুষ্ঠরোগ আক্রান্ত ব্যক্তিদের সম্মান অধিকার নিশ্চিত করা জরুরি প্রয়োজন। কুষ্ঠ রোগীদের দ্বারা গঠিত প্রতিষ্ঠানগুলোকে আর্থিক সহায়তা নিয়ে কুষ্ঠ রোগ আক্রান্ত ব্যক্তিদের নিয়ে কার্যক্রমগুলো আরো বেগবান করে তাদের শক্তিশালী করা জরুরি।
Through partnership with national and international level organizations, ALO is working in raising leprosy awareness in Bangladesh. ALO has been disseminating leprosy information using national media, social media platforms, as well as writing to the UN on behalf of the persons affected by leprosy. While working in fields with monetary support from Sasakawa Health Foundation, ALO has identified a couple of more actions needed to be done for persons affected by leprosy and raising mass awareness. The points are boosting leprosy information dissemination activities using media and various social means, platforms, as well as arranging more assemblies attended by persons affected by leprosy. Keeping ulcer care service MDT treatment dynamic during the COVID-19 pandemic. Ensure COVID vaccines for the persons affected by leprosy in Bangladesh. Ensuring complication management for persons affected by leprosy in all government hospitals, including medical colleges in the country. Reducing social stigma and ensuring equal rights of persons affected by leprosy is an urgent need. Strengthening facilities towards self-help groups of persons affected by leprosy towards the socio-economic development and assurance of their livelihoods. Increasing monetary supports and empowering leprosy people's organization is an urgent need to save the forgotten and stigmatized persons affected by leprosy in Bangladesh through various activities. Thank you.
Thank you.
Thank you so very much for sharing with us your impressive work. It is indeed, ALO is doing an amazing work in Bangladesh. And if I may use the opportunity to thank you for your great submission to my report, which is highly appreciated. Thank you so much. It has been a pleasure to meet you again. Thank you. Well, so now I kindly ask Mr. Andekar from SKSS from India to kindly share the organization's inputs with us, and thanking to the support of Mr. Ashutosh in translation. Please, Mr. Andekar, the floor is yours.
मित्रहो नमस्कार. मी श्रावण हंडेकर, कुष्ठांतीय. माझी संस्था सक्षम कुष्ठांतीय स्वाभिमानी संस्थेच्या वतीने आपणास शुभेच्छा देतो.
Hello friends, I'm Shravan Handekar, a person affected by leprosy from community. I bring greetings from my organization, Saksham Kushtantiya Swabhimani Sanstha.
आज मी माझ्या संस्थेमार्फत कुष्ठ कलंक व भेदभाव नष्ट करण्यासाठी गेली जाणारी ऍडव्होकेसी व जनजागृतीच्या प्रयत्नावर बोलणार आहे.
Today I'm going to talk with you about the activities and efforts taken by our organization to eliminate leprosy stigma and discrimination.
संस्थेच्या ऍडव्होकेसीचे मुख्य ध्येय हे समाजातील कुष्ठांतियांना प्रतिष्ठेचे जीवन जगता आले पाहिजे, यासाठी समाजातील इतर नागरिकांप्रमाणे समान संधी व हक्काचे स्थान मिळवून देणे.
The main goal of our advocacy through our organization is to ensure that the person affected by leprosy in the community can lead a dignified life, and for that matter he will get equal opportunities like fellow citizens.
ऍडव्होकेसी जनजागृतीचे काम आम्ही जिल्हा, तालुका, गाव पातळीवरील आमच्या मार्गदर्शन संस्था अलर्ट इंडिया मुंबई अवॉर्ड नागबीड यांच्या सोबतीने करतोय.
The advocacy activities which we carry out are in partnership with our guiding partners, Alert India Mumbai and our Sanstha. That is, it is done at level of district, blocks and village level.
या प्रयत्नांचा उद्देश हा आरोग्य विभाग, जिल्हा प्रशासन, गाव स्तरावरील लोकप्रतिनिधींना कुष्ठांतियाच्या अधिकाराबाबत संवेदनशील करणे आहे, जेणेकरून कुष्ठांतियाच्या मानवी अधिकाराचे उल्लंघन होणार नाही. पात्रतेनुसार त्यांना शासकीय योजनेचा लाभ मिळेल.
The prime objective of our advocacy is that the functionaries or the authorities at health departments or at the district administration are sensitized about the rights of person affected leprosy, so their rights are not violated, and also they will be enabled to avail all their entitlements over government schemes.
यासाठी संस्था एका रणनीतीनुसार काम करते.
For this we work according to our definite strategy.
समाजातील 550 पेक्षा जास्त कुष्ठांतियामध्ये नियमित भेटीद्वारे त्यांना मानवी हक्काबाबत जागृती करीत त्यांच्या अधिकार उल्लंघनाच्या समस्या शोधून काढल्या.
In the process, we have reached to the more than 5,500 leprosy affected person in the community, sensitize them about their rights, and also try to identify any rights of violation issues among them and try to address them.
कुष्ठांतियाच्या आरोग्याविषयी समस्या सोडवण्यासाठी शासनाच्या आरोग्य विभागातील अधिकारी व कुष्ठांतियाच्या प्रतिनिधीच्या नियमित माध्यमातून समस्या सोडवण्याचा यशस्वी प्रयत्न करण्यात आलाय.
As pertinent to the rights of health, right to health, and to ensure that there is no violation of right to health, we had the participatory meeting with the officials of health departments, and through that we have found that we have addressed the issues of right violation.
कुष्ठांतियाच्या कौटुंबिक, वैवाहिक आणि सामाजिक समस्या सोडवण्यासाठी महिला बचत गट, ग्रामपंचायतीचे लोकप्रतिनिधी, गावातील प्रतिष्ठित नागरिकांना सभामधून संवेदनक्षम करून त्यांच्या सहभागातून समस्या सोडवण्याचा प्रयत्न केलाय.
As regard to other human rights, like at family level, social level, workplace level, we try to sensitize the community members in self-help group or among the elected members at the Gram Panchayat or the village level, and from that we try to identify issues of right violation and try to address them through participation of the community members.
कुष्ठांतियाच्या सहभागातून आतापर्यंत 223 ग्रामपंचायतींनी ग्रामसभेच्या माध्यमातून कुष्ठ कलंक व भेदभावाच्या विरोधात ठराव पास करून कुष्ठांतिय आणि त्यांच्या कुटुंबियांना त्यांच्या मानवी अधिकाराच्या संरक्षणाची हमी दिली.
Through active participation by person affected leprosy in the community, we were able to move and pass the resolution at village assembly level, at Gram Panchayat level. So the resolution has ensured the protection from stigma and discrimination towards person affected by leprosy. That has been done in the more than 225 villages.
यामधून भेदभावापासून संरक्षण तसेच कुष्ठकलंकाचे समाजाच्या माध्यमातून उच्चाटन करण्यासाठी समाज मन तयार होत असल्याचे दिसून आले. असे कुष्ठ भयमुक्त समाज तयार होणे ही काळाची गरज आहे.
We observed through this process, after passing through the resolutions through Gram Sabha Assembly, the social mindset has become very positive towards person affected with leprosy in their villages, and they got the protection against the right violation in the villages, and this particular mindset is very important.
मात्र ही फक्त सुरुवात आहे, अजूनही खूप काम करणे गरजेचे आहे.
We understand that this is just a beginning at our organization level. There are miles to go.
यासाठी 350 पेक्षा अधिक कुष्ठांतियांना विविध स्तरावरील सभामधून संवेदनक्षम करत त्यांच्या 189 सक्षम कुष्ठांतिय समिती तयार करण्यात आल्या. यामध्ये 1000 पेक्षा जास्त कुष्ठांतिय सक्रिय सभासद आहेत.
To take this movement forward, we have reached to 3,500 person affected leprosy, and they were sensitized various community level meetings about their rights. And after the sensitization, they formed more than 189 self-help committees to do the awareness programs in the community.
गाव स्तरावरील जनजागृतीसाठी विविध समाज गट, ग्रामसभा यांच्या कुष्ठांतियाच्या अधिकाराबाबत चेतना सभा घेतल्या.
Even at a village level, at a village assembly level, we have taken sensitization meetings.
यामध्ये कुष्ठांतियांनी स्वतः पुढे येऊन आपले अनुभव न लपवता उघडपणे मांडले. यांचा अपेक्षित समाजमन तयार करण्यासाठी सकारात्मक परिणाम झाल्याचे अनुभवास आले.
During this awareness meeting at the village level or the community level, a person affected by leprosy has openly and proactively participated by sharing their experiences of right violation, and this has contributed to change the negative mindset, and we have found that the community mindset has been turning positive.
याशिवाय राष्ट्रीय दिनाच्या शाळा, ग्रामसभा, शासकीय कार्यालय, आरोग्य संस्थांमधून कुष्ठांतियाच्या अधिकाराच्या रक्षणाचा गाव स्तरावर सामूहिक वचननामा घेण्यात आला.
We have also attempted to do some kind of awareness activity on the day of national day, like Independence Day, where the villagers or the mass gathering were given the pledge against stigma and discrimination and given pledge to protect the rights of persons affected by leprosy.
कुष्ठांतियाच्या अधिकार उल्लंघनाच्या प्रत्यक्ष घटनावर आधारित जिंगल तयार करून जनजागृतीसाठी वापर करण्यात आला.
We have also produced evidence-based jingles, audio-visual jingles based on the rights violation, and that was used for the awareness purpose.
आमच्या सुरुवातीच्या अनुभवावरून कुष्ठ कलंक भेदभावामुळे समोर उच्चाटन कुष्ठांतियाच्या सक्रिय सहभागानेच होईल असे वाटतंय.
What we believe in with our initial experience is that the elimination of stigma and discrimination is only possible by active and proactive participation of persons affected by leprosy.
यासाठी समुदायातील अधिकार उल्लंघनाच्या घटनांना डाटाबेस तयार करून त्यांच्या कार्यक्रमाची आखणी करावी. जनजागृतीमध्ये कुष्ठांतियाच्या अधिकारावर अधिक भर द्यावा. त्यासाठी अधिकार उल्लंघनाच्या प्रत्यक्ष घटनांचा उपयोग करायला हवाय.
To achieve this, we also suggest that there should be some database at community level for of the persons affected by leprosy encounter with rights violation, and then we should also create awareness on the basis of evidence of it.
अधिकार उल्लंघनाच्या समस्या शोधून काढणे आणि त्या समस्या सोडवणे यासाठी समुदायाच्या माध्यमातून राष्ट्रीय कार्यक्रमाअंतर्गत एका संरक्षणाची यंत्रणा निर्माण होणे आवश्यक आहे.
We also, with our experience, we also suggest that there should be some provision or the component in the national program for undertaking a survey, regular survey for identifying cases of rights violation and plan accordingly.
कुष्ठांतियाच्या अधिकार उल्लंघनाच्या समस्या किती व त्यापैकी किती समस्या निराकरण झाले याबाबतच्या इंडिकेटरचा समावेश शासनाच्या राष्ट्रीय कार्यक्रमात करावा. त्यानुसार कार्यक्रमाचे मॉनिटरिंग करावे.
We strongly recommend that the national program should be monitored on the basis of indicators which need to be included in the monitoring system, and the indicators should be pertaining to the issues of right, how many cases of right violation, and from that how many cases are resolved. So this can be new indicator added which are not there at the present, that will lead us to problem.
या प्रयत्नाने कुष्ठ कलंकाचे समोर उच्चाटन करता येईल असे वाटतंय.
We strongly believe that with this process and this approach, we will be able to eliminate stigma against leprosy affected persons.
परत एकदा या संधीसाठी सासाकावा हेल्थ फाउंडेशनचे धन्यवाद.
I thank Sasakawa Health Foundation for giving this opportunity. Thank you very much.
Wow, Mr. Andekar, this has been really an impressive presentation and contribution. Congratulations on the amazing work you're doing in your country and at the community level. And I just, if I may, emphasize the importance of what you just said regarding collection of data and monitoring of human rights violations. That is a major gap, not only in India, but in all countries where leprosy is endemic, and not just those. That is something that we all need to join efforts to fight for, proper data collection and monitoring. Thank you so much. This was a privilege indeed. Thank you very much.
Thank you.
Thank you.
Well, today we are on time, which is quite a surprise. I think we are improving I am improving management. So now I will open the session of Q&A, and I will start with a question that came from Sunil Kumar from India. Sunil asks two questions, but I will summarize in one alone. Sunil is asking, what are the vision and mission to achieve the target of social integration of persons affected by leprosy in mainstream society? I invite speakers to reply to this important question from Sunil, but I don't know if anybody else to answer to. I think the floor is open to anyone who wishes to answer this question. Does anyone wishes to answer this question? Well, then, if I may, yes. Papa Mamadou, go ahead, please. Thank you.
Merci beaucoup, Dr. Alice.
Thank you very much, Dr. Alice, and my predecessors for their contribution. I think that if we're going to have the inclusion of people that are affected by leprosy, and I have the habit of saying we cannot do something for somebody without integrating them. An integration of these people that are affected in these decisions must be a priority. The people that are affected by leprosy are people that have great ideas. They know what they need. And if the program that will be developed for people that are affected by, they should be included. And if they're not included, we won't get to that goal. The people that are affected by leprosy need this. Now, if we integrate them in these decision-making processes, all the decisions that will be taken, we discuss with them before making a final decision, I think we would be on the right track. Obviously, there's the training that is there. Let's not forget that we must strengthen the capacities of these people that are affected by leprosy if we want them to produce good documents, if we want them to do their own fighting and defense. So I think that those are things that we are to take into consideration to facilitate the inclusion of people that are affected by leprosy. Thank you.
Thank you very much, Papa Mamadou. So let me share with you the other questions we have received, and I invite the audience to send their questions because we have some time. So Andrés Cardoso asks specifically to Artur Custódio, who has provided some comments to the initial presentations. He asks, Artur, do we have any knowledge of the estimate regarding distribution, delivery of MDT for 2021? Artur, the floor is yours.
Bom, primeiro agradecer, Andrés, pela pergunta. E eu acho que ele fez três perguntas.
First off, thanks Andrés for your question. I think he has three questions at the same time. I'm going to try and cover the three of them. First off, we don't have, there's no transparency in the process. I think there's failures in every single layer of the process, since production by Novartis and the distribution by the WHO. There's a failure of local governments that have become highly dependent on international production and donations, so they don't have regulating stocks, emergency stocks, emergency warehouse, because it is a neglected disease, and in some countries the number of cases is very low. So the difference from one country that has 10 to 15 cases of Hansen's disease, and you can put the medication in the well, there's a crucial difference. Of course, what we expect in terms of persons affected by Hansen's disease is a movement. We need a higher transparency in the process. The whole chain of this process should look at persons affected. Then we will listen to testimonials, because sometimes bureaucracy is too far away from people, and we are in the tip or the edge of the system. And we realize when COVID started, for instance, we had to create masks, to make masks, distribute food kits, because people were hungry. We are connected at the very edge of the system. We see how much people suffer. One of the issues we were discussing in this seminar is mental suffering. They should. We said that we always say that they should never stop treating themselves, but they are unable to get medication. If you have alternative schemes for people by the pharmacy, this speeds up the social inequity, because most of them do not have access. A very small group of people are able to buy alternative medication. So this has got to be provided by the government. So my answer is there's no transparency in the process. And then you ask about effectiveness. Well, I think we have to go further deeper on the quality of the medication. I think Mohan in Brazil is going to request a partner institute of a local investigation, a local research institute, to investigate the quality of the medication, because one of the we were made aware that one of the medications had a high level of toxicity. And lastly, I agree when Andres says, well, if lack of medication is a stigma, yes, it is. He says so. And it is true. We prepared a post, an internet post, a card covering this issue. In Brazil, the World Hansen's Disease Day covers the stigma. We are discussing the lack of medication as a structural stigma. The lack of medication is a stigma from the government, from societies. Of course, there's medication for those who, I should say, they are at the highest societies, higher level society, higher level of society. So, Alice, if I may, I'd like to cover Sunil's question. I think this is critical as well. We should always bear in mind, as I said in the beginning, organizations are a path. Strengthening national organizations is a path to influence public policies. Let's keep in mind that states, government, and Mohan works together or against the government, and sometimes within the government. There are different layers, there are weaknesses. States aren't monolithical. Sometimes Mohan is doing well with the Ministry of Health, and sometimes we are fighting against the Ministry of Education or the Ministry of Human Rights. So we should look for loopholes to work on, and I'm more and more convinced of it, because the topic was covered by the Global Appeal, and I'm convinced that one of the paths for us to break this cycle is the path of the education. There have been some scholarship experiences in Mohan that we got for people, and it was impressive how that broke the cycle. And allowed people, for the movement itself, empowered people to break stigma and social inequity as well. Well, I hope I have addressed your questions and contributed somehow.
Thank you very, very much, Artur. It was indeed an important contribution that you just gave us all. Thank you very much appreciated. So I think we should now close our panel discussion. We don't have more questions, and I think we did receive so much information today, a very important one. And before passing it on to Professor Takahiro, if I may, I would like just to highlight something that I think it's very important not to forget about. We need to, and we saw today we had 5 organizations sharing their expertise with us on these issues, and we saw that some organizations are facing significant barriers in what regards advocacy work. And so I would like not only to highlight the amazing achievements that organizations do, and they are truly the ones at the forefront of the fight against stigma, but also the barriers they face. And so I would like to call upon, bigger civil society organizations to always put at the top of their priorities the support to local and national organizations of persons affected by leprosy, since we also have seen during this panel discussion that partnerships are key to the organization's work. And so I close by once more thanking Sasakawa Health Foundation, not only for providing us with this important space for discussion, but also for having always put the support to the people's organizations at the top of their priorities. Over to you, Professor Takahiro, and thank you very much to everybody. See you tomorrow.
Thank you very much, Alice. I appreciate your time management. And yes, as a foundation, we get lots of important learning from each organization. We really appreciate to directly hear your voices. So thank you very much all for being with us today. Tomorrow will be the last day of the webinar. So it will start at the same time, at 12 p.m. Central European Time. So thank you very much, and we look forward to meeting you tomorrow. So have a nice day.